I'm Dr. Sawar Eqbal. I'm a urologist. I've done MBBS in 1999 and then MS in general surgery in 2002. And after that, I did 2 years of senior residency in urology from Lybrate Institute of Delhi. Then I've done my DNB urology and kidney transplant surgery from Sir Gangaram Hospital in 2008. And I'm working as a consultant urologist for the last 8 years. I've been attached to reputed hospitals of Delhi and NCR. So today I'm going to talk about the rampant problems happening in and around the Delhi, that is urolithiasis or kidney stones. The kidney stones are becoming very common day by day in Delhi NCR. Out of 8-10 cases of OPD, we are seeing around 5 to 6 cases of stones only. They are very rampant in the age group of 20 to 40 years of age. It is more common in male. And the most common cause which we see is inadequate hydration of the body, because of which there is crystallization of the urine that sediments in the kidneys and become stone later on. So you have to be very careful for your health, and this kind of problem is very common in summers because of the perspiration and sweating. There is a lack of water inside the body. They get precipitated in the kidney and then takes the shape of stone. The stone is one of the commonest cause of destruction or damage of the kidney worldwide. So what do you do in cases of kidney stones? The most important thing is the awareness among the gentry, that they should know what is the exact cause of the kidney stones and how it can be checked, how it can be prevented. So keep yourself hydrated throughout the summers. You are supposed to take at least that much of water so that you can produce at least 2 liters of urine a day. There are certain conditions where it is very common amongst the family. That is the maybe the familial or maybe related to some kind of food which is very common in certain families, like non-veg, particularly the red meats, where it causes urate stones. So now come to the different kinds of stones which are very common in India and all around the India. Number one is the oxalate stone, number two is the urate stones, and then the other stones. So what does they cause? This kind of stone is actually formed in the kidney, but once they are in the kidney, they start growing up and they can take the size of the stone, where it is known as the size of the kidney. So they actually start forming in the kidney, and if it is not taken proper precautions and proper treatment, they can take the shape of the kidney and can last to up to the size of the kidney only, and this is known as the staghorn calculus, and they can cause complete destruction of the kidney, where the kidney can fail just because of the stone. When this is small, they can cause obstruction of the kidney at certain points, like the PUJ. That is a very common cause of the obstruction, where they can lead to swelling of the kidney, lot of pain, lot of infections, and maybe later on, if it is not corrected, not de-obstructed, that can lead to damage of that kidney permanently. They can trickle down into the ureter. Ureter is the line that comes from the kidney and they communicate with the urinary bladder. So they can obstruct the ureter at any point from kidney to up to the bladder level, and they can cause ureteric colic, that is very severe kind of pain with lot of colicky pain associated with nausea and vomiting, burning sensation, and at sometimes they can cause blood in the urine, profuse bleeding in the urine off and on. And if it is not corrected, if it is not de-obstructed, then again can lead to the destruction of that kidney. Sometimes this stone can come to the urinary bladder and they can choke the urethra, and patient may have some problem passing the urine, and this is known as the obstruction or the retention of the urine, for which he can require catheterization and later on the removal of the stone. So what are the what are the modalities of treatment of the kidney stones or the urolithiasis? The modalities depend on the size of the stone as well as the location of the stone, the other parameters of the patient itself, like comorbidities like diabetes or hypertension or CAD associated conditions of the patient itself. So first, to the site and the position of the stone. If the size is less than 1 centimeter lying at any place in the kidney, so on the management part, the management depends on the size and the location of the stone. If the stone size is less than 1 centimeter and the stone is lying well inside the kidney, then the treatment of choice is very simple. This is known as the ESWL or lithotripsy, where it requires some shock waves which are given to the stone, targeted to the stone. The stone becomes pulverized, just become like sands and then expelled out through the urine itself. If the stone size is more than 1.5 centimeter, then the treatment of choice is like mini perk or the PCNL. If the size is less than 1.5 centimeter and the patient is not willing for the ESWL, because ESWL requires some staging, then the one very good option is the RIRS. This is known as the retrograde intrarenal surgery, where we put a endoscope inside the kidney through the urinary passage, and through the laser we blast the stone and take out the fragments from the kidney itself. The patient don't require any kind of incision, not even the buttonhole incision. When the stone is lying inside the ureter, then the treatment of choice is the URS. This is known as the ureteroscopy and DJ stenting. If it is lying in the bladder, then the modality of treatment is the laser cystolithotripsy, where we pass endoscope inside the bladder and pulverize the stone through the laser and take out the fragments. Whenever you are having this kind of problem like urinary stone, where the stone is lying anywhere in the kidney or the ureter or the bladder, you can contact Lybrate and you can take direct appointment with me and come to the concerned clinics.